Welcome to the 20th Research and Evaluation Conference on Self-Sufficiency, REX, and the first ever virtual REX. I am so happy to kick off this year's conference. ACF has been convening REX since 1998 to present the latest findings from evaluations of programs, policies, and services that support low-income and vulnerable families on the path to economic self-sufficiency. We bring together a broad audience, including state and local government administrators, federal officials, policymakers, and researchers. While conference sessions focus on research and evaluation, sessions are designed to support policymakers and practitioners in understanding, developing, and employing research, and many of the sessions speak to the direct needs of practitioners. We will hear from our experts about exciting developments in our nation's approach to alleviating poverty, expanding opportunity, strengthening families, promoting unemployment and mobility, and ensuring the well-being of our youth as they transition to adulthood. Our plenaries also feature discussions of cross-agency partnerships, the latest findings from the Health Profession Opportunity Grants, evaluations, implementation of the Evidence Act, the new Pathways to Work Evidence Clearinghouse, and our response to COVID-19. The virtual REX 2020 will also feature breakout sessions, facilitated network roundtables, emerging scholar poster presentations, a symposium speaker, and a panel discussion on careers and family self-sufficiency research. As many of you know, REX 2020 was originally scheduled to be in person in May. ACF is grateful for your patience and support as we worked to convert the 2020 conference to a virtual format. The virtual REX 2020 will be held each afternoon from October 13th through the 15th and the 19th through the 22nd. We have the incredible opportunity to have colleagues log in from around the country. With that in mind, remember that our schedule is in Eastern Time. If you're unable to attend a session, all plenaries and breakouts will be available for viewing after the event. You can also view the full agenda by navigating to the Agenda tab at the top of your screen. Let me take a moment to thank you for all your service during these incredible trying times. You have been instrumental to the country's response to this pandemic. You've done this despite the impact it's had on your own personal life. I know that the pandemic has affected every American in some way. Your work, every service that we can make better, helps us move closer to living in the America that we envision, a country where all of us can be safe and self-sufficient. I'm proud to say that our work here falls under our three priorities at ACF of promoting permanency and adoption for all waiting children, primary prevention, and economic mobility. Our top priority is promoting adoption and permanency for the children that are waiting in foster care. This includes encouraging governors, state agencies, tribes, nonprofits, businesses, faith-based organizations, and local communities to work together to find permanent, forever loving homes for every waiting child and every youth, and provide support for the families who step up to care for them. Our second priority is to promote primary prevention, which means proactively connecting families to community-based comprehensive services before they are in crisis, in order to strengthen a family and prevent child abuse and neglect from ever occurring. This ensures the safety and well-being of children and families and prevents them from having to engage in our child welfare system and interventions. Our third ACF priority is to promote economic mobility. This means to shift the culture around public assistance programs and encourage a long-lasting change to the welfare system that empowers individuals, families, and communities to achieve their fullest potential and thrive financially, emotionally, and physically. One area that will be addressed at this conference is our work with ensuring the well-being of our youth as they transition to adulthood. This is just one example of how your work helps improve the lives of vulnerable young people. We understand that approximately 60% of children come into foster care for reasons that include neglect. Neglect is frequently associated with the consequences of poverty. However, poverty alone is not a reason for removal. When we wait for someone to report to the child abuse hotline that a child has been neglected, we have failed families who need help. Oftentimes, we fail families in meeting just basic needs, and the alternatives to these dire circumstances are often challenging. We must focus our efforts both on preventing the need for foster care in the first place and on ensuring the children in this system have the security of a loving family. Nearly 122,000 children in foster care have a plan for adoption, but have not yet achieved permanency. Each year, close to 20,000 youth age out of care without the support of a forever family, a loving, permanent family to help them navigate their entry into adulthood, celebrate holidays with, or support them as they pursue their dreams. Sadly, many of these young men and women will experience higher rates of homelessness, incarceration, and unemployment. That's not okay when they leave foster care. Every child deserves a forever family. So in 2019, ACF launched the Assistant Secretary's All-In Foster Adoption Challenge. This national challenge is geared towards finding permanent homes for the 122,000 children and youth who will still be waiting for their forever families. We know we can't do this alone. This requires the efforts of states, courts, faith-based organizations, the private sector, nonprofits, businesses, communities, families, and researchers. We are also engaging with governors to champion this issue at the state and local levels. We are on a mission to find and support permanent homes for these children, each of whom has dignity and their full potential waiting. We're seeking partnerships to reach families who are able to open their hearts and homes to sibling groups, to children with disabilities and teens, all of whom have waited much longer than they should have. These children need a permanent family that will provide that love, that security, and that encouragement through all of life's challenges and joys. We are also deeply invested in researching and evaluation in this area. Your work, some of the work that will be presented today, helps to analyze and improve our services for these young people. Moreover, this work extends to other areas that are tangential to this one, such as childcare, Head Start, and poverty reduction. In supporting these efforts, President Trump signed the executive order on strengthening the child welfare system for America's children. This executive order demonstrates the commitment of this administration to ensuring that children benefit from the care and support of loving, permanent homes, preferably their own homes whenever possible. First Lady Trump has made this her mission, and she plans to work on this continuously as we move forward. Through the three key areas of focus addressed in the executive order, Health and Human Services and the Administration for Children and Families are ready to work with partners at all levels of government, as well as those partners outside of government, to advance this common, noble, and pressing goal. Again, your work ensures that policy innovations such as these can happen. We're about to hear example after example of how we can apply your research and evaluation to improve the lives of children and families. Thank you for joining us for the Virtual Rex 2020. We know many of you are juggling new and added responsibilities right now, and we appreciate your time. We hope that you will find this information valuable and actionable as you continue to do the important work of serving vulnerable families and children, many of whom are struggling the most right now. Most importantly, I hope that you and your family are staying well. Now we'll transition to the first session of the conference, a plenary led by the Office of Family Assistance Director, Clarence Carter, on cross-agency partnerships, which I am honored to be in. I'll see you there.
Hello, good afternoon, and welcome. We are very excited to have all of you join us this afternoon. My name is Christy Putnam. I will be the moderator for this opening plenary session, which is entitled One Workforce, a Federal State Partnership Initiative for Innovation. And I'm very, very excited to be joined by a stellar crew who is participating in this session today. I want to take just a couple of minutes for housekeeping and to just remind you all of a few things to keep in mind while we are talking today. I do want to encourage you to engage with OPRE and conference attendees on social media. All of these things will be broadcast via Twitter, Facebook, Instagram, and LinkedIn. You can follow OPRE on these platforms. You can share your reactions. You can post highlights, whatever you would like to do. And just make sure that you use the Rex 2020 hashtag to be part of the conversation. I also want to encourage you as we go through this conversation this afternoon to submit questions via the chat box. We will get to as many of those as we possibly can. And then I do want to remind you this session is scheduled to go until 1:45 this afternoon. And I'm sorry, 2:45 this afternoon. And after that, there's a 15-minute break and the next session starts at 3 o'clock. So again, my name is Christy Putnam. I'm a senior policy consultant and partner at Connecting the Dots Policy Solutions. And I'm also a contracted advisor with ACF. And I want to take a couple of minutes to thank and welcome our panelists this afternoon. And I'm going to briefly introduce each of who we have sitting with us today virtually, and then give them a couple of minutes to talk a little bit more about who they are and what they do. So I'd like to start with Assistant Secretary Lynn Johnson. Assistant Secretary Johnson is the Assistant Secretary for the Administration for Children and Families at the U.S. Department of Health and Human Services.
Thank you for having me here. It's just, you just heard me talk, so I'm not going to say much more, but it's just really an honor to be here. Thank you.
Thank you, Assistant Secretary. Next, I'd like to introduce our next panelist is Assistant Secretary John Palish, who is Assistant Secretary for the Employment and Training Administration at the U.S. Department of Labor.
Thank you, Christy, and thank you to HHS and SNAP-E&T for allowing the Department of Labor to join today's discussion. At the Department of Labor, the Employment and Training Administration is responsible for all of the workforce programs as well as the unemployment insurance program. And I have to disclose that in a prior life, I worked for the state of Kentucky, running their Office of Employment and Training, which had many of the same programs that I'm responsible now for at the state level. And during my time in Kentucky, I had the opportunity to work with Christy while she was at the Cabinet for Health and Family Services. So this idea of one workforce, you could say, was birthed in Kentucky many years ago as we looked to bring workforce and health and family services and SNAP-E&T and TANF and all the other federal partners together. So I really appreciate the opportunity to be here.
Thank you so much, Assistant Secretary Palish. Deputy Undersecretary Brandon Lips is the Deputy Undersecretary for the U.S. Department of Agriculture's Food, Nutrition, and Consumer Services Division. Thank you for joining us today.
Thanks, Christy. It's great to be here on behalf of both the SNAP National E&T Forum and the REX Conference. I want to say a big thanks to our friends at HHS for letting us, I guess you call this video bomb their conference. In reality, we were focused on having the SNAP National Employment and Training Conference this very same week as their REX Conference. And we all had the same idea with this commitment to one workforce, that we have a panel with our federal workforce partners. And I want to say a big thanks to both of our teams and our contractors for making it work, where we can bring everybody together live at the same time for this conference. What is SNAP-E&T? Certainly the folks on our E&T forum know, but just briefly for the folks on the HHS side, some of who do know and some don't. SNAP, as you know, is one of the nation's largest nutrition assistance programs and serves tens of millions of Americans, but it also has a component Congress has provided to us for employment and training, which provides great opportunities that we'll talk a little bit more about later today for our constituencies across the country. But it does need to be blended with the one workforce. We are not the workforce agency at USDA, but we have a lot to bring to the table. And I'm so excited about this One Workforce initiative with my colleagues at HHS and DOL that we can come together to better serve people. And so we're committed to doing that and excited to be here with everybody today.
Absolutely. Thank you, Deputy Undersecretary. And I'd lastly like to introduce Director Clarence Carter, who is the Director of the Office of Family Assistance at HHS Administration for Children and Families.
Christy, thanks so much. It's a pleasure to be here with you and our power panel. If you can imagine the challenge to bring 3 senior administration principals together in a comprehensive initiative, and that's what we're going to spend a little bit of time discussing today. But the idea is to take this, if you would, horizontal approach to the issue of work and not the vertical siloed design that is fundamental to government. So it is my honor and privilege to be joined with this panel today and to be a part of this important.
Absolutely. And it is my honor and pleasure to be your moderator and to walk through a series of questions. And really some of I feel like this is sharing some of the conversations or that we're going to share some of the conversations that we all have been having for a while now with the idea of cross-agency support for one workforce and supporting all the people we serve. So with that in mind, I'd like to go ahead and get us started. And to kick us off this afternoon, and then I'm going to lead us through a number of just questions discussing the approaches we might take in this one workforce approach. But I'd like to ask Director Carter to go ahead and kick us off and talk about work as it relates to the 3 programs represented by our panel members. What is that meaning of work?
So Christy, if I could, but before I dive into that, one of the biggest challenges of government is its vertical and categorical design. So there's a program and agency, for every condition, and they are designed to exist vertically within each is sort of the self-contained bubble. But yet, none of the problems that we are trying to address present themselves that way. And so we are not designed to operate horizontally. Okay? But the good fortune here is that we actually have 3 principals whose vision is beyond simply the programs that they administer, that their vision is for the health and well-being of the society, understanding that they have, in their individual responsibilities, have a role to play in that broader vision. And so we see in this administration as work being a fundamental tool to freedom to create your own unique vision of America. That we don't see work as in any way, shape, or form being punitive. We see it as being a pathway to freedom. And so our objective here is to looking at the broader issue of work, not just the individual programs, but these principles represent 3 major government investments in work. And so they have been doggedly determined to work not vertically, but horizontally to achieve the objective of engaging one workforce.
Yes, absolutely. That's what I was hoping you would start us off with, Clarence, is the vision behind this, the commitment that the 3 principals who are part of this panel share to making sure that we figure out ways that we can collaborate and make this work together. And I think Clarence just coined our first hashtag for this panel. I think it's hashtag think horizontally. So I would recommend and challenge all of you watching out there to just start thinking horizontally. What can you do across programs? And that's really going to be the discussion that you hear us have during the next hour or so. So start thinking about your questions too. I would like to ask also Assistant Secretary Palish, Deputy Undersecretary Lips, and Assistant Secretary Johnson to offer any opening thoughts that you have along the lines of what Director Carter just shared with us.
Sure, Christy, thank you. I couldn't agree more with Clarence. One of the first things that I did when I came to DC last July was begin calling around to the other federal agencies who I knew had workforce programs, who I knew were serving many of the same customers that we were serving, to start this conversation about how can we better serve those customers. rather than, as Clarence indicated, thinking that they're our customers and we must own them. The Workforce and Innovation Opportunity Act, which is the governing legislation for the Department of Labor, how do we make them WIOA customers? How do we make them ours? And only we can serve them. When in all actuality, there are folks that we're serving who are quite frankly eligible for SNAP E&T benefits or eligible for TANF benefits. Our partners at the Department of Education, vocational rehab, adult education. Again, all of these workforce programs exist in these silos, as Clarence was mentioning, and it's our job and it's our responsibility, quite frankly, to give up a little bit of that control, to open that up, to allow the horizontal thinking to take place, to allow the federal partners to share those customers and realize that we all have resources and expertise that we can bring to bear to better serve those customers. And the more we can do that at the federal level, the more that frees up the states and the local partners to follow our lead. So that's really what we're trying to do here is set an example and then, quite frankly, get out of the way and let the folks at the state and local level take over and allow the federal bureaucracy to not be the hindrance.
I want to add to that. One of the things that I experienced when I first came here came from my actual workforce experience. And I was fortunate enough to run a government agency that had TANF, Medicaid, SNAP, WIOA. Every program was under one umbrella, which everybody said, oh, you can do so much, which is absolutely true. But at the same time, we also had Head Start. So we started a School to End Poverty where we asked the customers, what would it take to get you out of generational poverty and what should it look like? And we had all of the programs under one roof. But what we learned was that it, again, was our silos, and under one agency, we still had the hierarchy of silos, and then we, at that time, because we were at the state, 4 different federal agencies that we worked with. I said when I got here is if we could do what I had back then, because 1,300 people successful later was because we were able to knock that down. But if we could do that at the federal level and work together, we could model what we expect from those that we give money to serve these populations. And so you're looking at everyone that's here. When you talk to Brandon and John and myself, we have come together to say, we're going to walk our talk. We're not saying let's just get people to work. We're saying, what will it take to end poverty? And we know work is a tool to do that. So coming together is making a huge difference. The states will absolutely appreciate it. Locals will actually appreciate it more than anything. Our customers who could be hungry, scared, abused, homeless, you name it, will absolutely benefit from it. So it's thrilling for me to be with a team under President Trump who says, get rid of the barriers and move these things forward.
Christy, I echo all of that Assistant Secretary Johnson and my other colleagues just said. And I want to say, as I arrived on the scene at the Food Nutrition Service and traveled around, the greatest stories of hope I saw in the recipients we served were those who had been connected back into the workforce and the dignity of work through programs like SNAP E&T. But as I talk to those local partners, they're not concerned about where their funding stream comes from. They know how to meet families where they are. My boss, Secretary Perdue, talks to us all the time about moving families forward. We have a lot of local partners that know how to do that, and they don't care where their funding stream comes from. They want to focus on serving those individuals. And so I hear from local partners from states all the time that we need to reduce the red tape and help them serving where they can spend their time focusing on serving individuals. And I hope that even what to some may seem simple, the difficulty of actually bringing together 2 federal conferences today so that all of us at some of the highest levels of these agencies can talk to all of you about our commitment to actually helping you move families forward. That is our commitment to you. And I will say, Assistant Secretary Palash talked about getting on the phone when he first got here. I promise you, as soon as he sat down in his seat, my phone rang. And he said, how do we work together on workforce? And he has followed through on that. Assistant Secretary Johnson and Clarence Carter have been committed, and we at USD are just excited to be a part of this.
Well, and it is very exciting. It's something that I certainly was very involved in at the state level, and I'm thrilled to see the 4 of you having this discussion across 2 conferences and across 3 cabinets. And for our audience, it is a major undertaking to have this many top level leadership folks involved and committed, but they're consistent. They're always there when we have questions that we have to run through. So you've all shared a little bit about what it means to have one workforce and to serve customers across agencies and across funding streams. And, Deputy Undersecretary, to your point, the person who needs the services doesn't care where the funding to help them is coming from. They just need those services. And so those are the barriers we're trying to overcome. And I'd like to move into sort of another discussion around that, as part of the administration's efforts to reopen America and move Americans back to work. What are some of the ways through your programs and across other programs that the federal agencies are working together to help states during this time and to help people who have been dislocated by the pandemic and the economic downturn? And I will go ahead and start that question with, Deputy Undersecretary Lipps, let's start with you on that one.
Sure. It has been a commitment of this administration from day one to help move people back into the workforce. Certainly, there were some setbacks with that, with the difficulty that's come across the country during this time. But even now, we're seeing large numbers of individuals return back to work. On the SNAP ENT side, our local providers who function through the states have turned virtual and are serving recipients in that manner, and some of them able to serve more folks virtually than they were in person. But they still ask us the same questions of how do we do this in concert with our other partners through WIOA, through our local workforce development boards, and that's what we're trying to solve. And we've had our regional offices have been working together for that on that for a long time. But our commitment from my colleagues at the other agencies is that we're going to continue to find ways to make that work better. So as Assistant Secretary Palash told me when he first arrived, there doesn't need to be a wrong door for these folks to work in, and we're committed to making that happen as we move forward.
Thank you very much. And I'll ask that same question of Assistant Secretary Palash too. Is what are the federal agencies doing to work together and help states as we reopen and move Americans who have been dislocated from work back into the economy?
Yeah, thanks, Christy. With the onset of the pandemic, quite frankly, the Department of Labor was focused very much on unemployment insurance and making sure that individuals who were out of work were getting the benefits they needed. And also through a sister program at the Department of Labor, paid leave for individuals. But now as we start to transition back to reopening the economy, our friends at OSHA are making sure that workplaces are safe. And at ETA, our responsibility is to make sure that there are jobs to go back to. As Brandon was mentioning, providing virtual services. The American Job Centers around the country, of which there are 2,400, have moved to almost exclusive virtual service delivery. So making sure that, again, we're understanding what the needs of the customer are and working with our other partners to make sure that we can meet those needs rather than trying to provide them a prescribed set of services from our program. So really to Lynn Johnson's point about walking what we talk, not just saying, hi, this is the program I administer and I'm going to put you in it and I'm going to give you the services we have. It's better understanding what, as a customer, you need. What are the challenges you have? What are the barriers you have? And then leveraging not just the resources I have, but the resources of all my partners. So we've been pushing very hard on our state and local workforce boards to make sure that they are reaching out and engaging the other workforce partners to bring them in, because we've got an unprecedented number of folks who are looking to get back to work. And it's not a problem that agriculture or HHS or labor can solve on our own. We're really going to need a team effort. So I look forward to continuing that dialogue and continuing to encourage the state and local partners to let them know that they can step out of their lanes a little bit, and we in DC aren't going to get mad and snap their wrists.
Thank you. And Assistant Secretary Johnson, same question. Just what are our federal agencies doing to help states while we're reopening the economy as we recover from this? And Director Carter also, either of you.
I'm not going to repeat what you've already heard because both of our other panelists, they totally get this, but I do. So I'm going to kind of move to a different area. Let's talk about childcare. We're not going to get people back to work if we don't have a functioning childcare effort. And from the very beginning of the pandemic, we had to integrate childcare for essential workers. We had to find ways to care for children that was safe. We didn't know at the very beginning all the nuances around the COVID-19 pandemic. And so we also had to start identifying what works and what doesn't so that people can be healthy while they're caring for kids and can feel safe while they take their kids to a child care site. We have found alternative ways to do child care. We have worked with FEMA. We have worked with Health and Human Services, the Centers for Disease Control. We have worked across every part of federal government to make sure that Americans can safely go back to work. Then you add pieces that are very, very concerning is the difference. You hear Secretary Azar and the president talk about health versus wellness. As we see substance abuse increase, suicides increase, we have to look at that also and working together to make sure people have food. We're hearing a lot about food deserts, but to make sure people have work and can go back to work. None of that happens for families if they don't have quality childcare. And so that's been our priority. We have worked with every agency to make sure that what we're doing is safe and effective. Ivanka Trump visited some childcare centers, and we have seen it's doable and it's safe and it's out there for people if they can and should go back to work. So we are wrapping around those families with our best childcare can offer, not just for low-income families, but also for all of those families that need childcare in America. We are looking at the childcare efforts. Clarence, do you have anything to add to that?
I do. And this is going to seem a little generic, but I guarantee you it's fundamental. It is, how do we collectively get to a culture of yes, as opposed to a culture of compliance, okay, with the rules? We want to be able, we want to be able to get to yes for how we get those amongst us that are economically, socially, and developmentally vulnerable into the workforce. And so we have to not throw out the rules, but we have to understand that the question that we are trying to resolve is, how do we make work work? And begin from that posture. And so the nature of this collaboration is creating a culture of yes around work.
And Christy, if I could just really quick add on to that, to what Lynn was saying. From the workforce perspective, we traditionally think of the largest barrier to an individual going back to work as either some form of education or training. And for the most part, the public workforce system at ETA is decent at retraining individuals. It's decent at providing them the education. But what we're seeing in this pandemic is one of the biggest barriers is just that childcare. And that's not something that we, the Department of Labor, are equipped to deal with. And that's exactly why we're here today, so that partners can leverage the expertise that each brings to the table. Because we can't just train our way out of this, because we can train up all the individuals who are on unemployment insurance, but if they have children at home and they're not able to go back to work, that training does them no good. So again, you know, we'll keep hammering home this idea of one workforce, but really that's what we're here to talk about, is how do we bring these resources together? How do we bring the services together to better serve the customer?
Absolutely. That is what we have to talk about. And I know that, you know, sometimes the solutions can be simple. You know, we put in place in Kentucky, for example, a very quick referral service between the workforce offices and our child care eligibility offices. And, you know, so sometimes just realizing some of those simple solutions and being able to have the states raise those to our attention as far as what supports do they need from us. I am going to go ahead. We did have a question come in the chat box, and you know, understanding that we can't answer all questions on the fly, but for discussion purposes, it seems like something that would be good to just kind of bring up and talk about what we hope to explore through this partnership and through the commitment that we have to sharing resources and innovations. And the question that came in is, does the commitment to working together extend to aligning regulations? This particular individual or agency has come across regulations from programs that are at odds with the regulations of another federal program. And I know that, putting my state hat back on, we ran across that sometimes. Understanding that none of you can commit to what may happen in the future with regulations and statutes, is that something that we are committed to taking a look at through this process? And Assistant Secretary Palish, I'll go ahead and start with you this time, if that's okay.
Yeah, absolutely. It's not only is it something that I'm willing to commit to, it's something that we at the Department of Labor have been working on. As Lynn was mentioning earlier, even within a state, you may still have silos. Even within the Department of Labor, we had silos. We had regulations that required the provision of what are called Wagner-Peiser services to be done by state merit staff. We had trade regulations for our Trade Adjustment Assistance Program that again required specific state merit staff to provide those services. And what we did over the course of the last year at the Department of Labor was rewrite those regulations to allow states maximum flexibility. So they can provide WIOA services, they can provide Wagner-Peiser services, and they can provide trade services through whatever vehicle they think is easiest for them. If it's state merit staff, that's fine. If it's a single contract, that's fine. If it's a hybrid thereof, that's fine. But what we were trying to do was remove those regulatory burdens that forced the state to have specific sets of teams to provide our programs, and to take away those restrictions and say, you just need to provide the services. You at the state level, figure out how you want to do it. We will try to get out of the way. And we will continue to do that with all regulations to make sure that again, what we're trying to do is just facilitate. We're trying to facilitate this idea of one workforce at the state level. So if that means rewriting regulations, then we'll take a look at those regulations.
And Christy, if I could jump in on that one for just a second, and
Absolutely.
I'll do it with an example. Okay, early in this administration, Ohio came to us and they felt like they needed a waiver from TANF rules in order to serve disconnected youth. And so they were submitting a waiver application. And because we did not want to take an approach which looked like we were backing away from work, it was our objective to not approve the waiver, but help them to achieve their objective. So we had them bring their senior executives in and sit with our senior executives and tell them how they could achieve their objective within the confines of the existing rules. Having served at the federal, state, and local level, I know that oftentimes what we perceive at the state and local level as things we can't do are sometimes interpretations of things that we actually can do. And sometimes we cede authority to the federal government that is not to be ceded. And so, again, because we're trying to create a culture of yes, when the state or jurisdiction raises an issue about we want to take this one workforce approach, we will try to figure out, as long as that ask is legal, ethical, and moral, then we're going to try to figure out how to get to yes, as opposed to just saying this is what the rules say.
Yes, and Deputy Undersecretary Lips, just want to make sure you have a chance to add anything you'd like to say here too.
Sure, thanks for that, Christy. I'll add on to that. I obviously agree with what my colleagues said. I'll say that at USDA, the Food and Nutrition Service, we have an employment and training rule that's a result of the recent Farm Bill that talks about this very issue of states making sure that they're aligning across what their workforce agencies are doing. And, for a lot of states, an ENT program in a significant way is really a new program that they're putting on. And we don't want that to develop into a silo that would be adverse to everything that we're talking about today. So this rule really talks about coordination on the front end. We talk a lot at FNS about matching up our metrics on success with what they do in WIOA. Again, no matter what door those individuals come in, we want to make sure that we're serving them through to success in the same direction. And where regulatory change is needed, we're committed to that. Regulation changes are a difficult process, but if we're really caring about a human-centered design of who we're serving, we're willing to make the changes and committing to make the changes necessary to ensure that we can serve them regardless of what door they walk in.
Thank you. No, and that's, again, speaks to the shared commitment of the three principals and Director Carter in figuring out ways to get to yes. And that's really, what the intent is behind One Workforce and trying to talk across different programs. I'm going to shift for a second. It's actually not a shift. Some of the rules and regulations and requirements that are in place While we all experienced the COVID pandemic and the economic downturn and all of the increases in people who needed supports and applying for benefits, COVID changed the way Americans are living and working. It changed the way our programs and our staff and our frontline operate. One thing that has certainly changed is COVID sort of shone a spotlight on some of those regulations and some of the requirements that states have often raised up to the federal level to say, we're not sure this is helpful or productive, or can we waive this? And, the answer for a period of time due to COVID for many of those questions was there were a lot of flexibilities and a lot of waivers and a lot of permissions that were extended by the three federal agencies represented here today, primarily Labor and USDA. How do you think that some of these flexibilities helped people better serve increased caseloads? What do you think we will need to do to move forward to take a look at some of the flexibilities that have been extended? And how do you think that some of the frontline staff, I'm sure you've heard, have been directly impacted by the change in not just caseload, but their work circumstances? I'd like to get your thoughts, each of you, on that. Deputy Undersecretary, we'll start with you this time. I'm trying to be fair and a round robin approach here.
You're a good moderator, Christy. Thank you for that. I will say, Assistant Secretary Johnson mentioned earlier the need for food, and that is, I want to make sure we don't forget representing the Food and Nutrition Service, and making sure that folks have access to adequate nutrition is really a very important first basic step in moving people into workforce training. And so we at USDA's Food and Nutrition Service during the pandemic have issued more than 4,000 flexibilities across our suite of 15 programs to ensure that all Americans have access to food as we move forward in this pandemic. And that's the first step really in making sure that they can get in to education and training programs to help them move back into jobs as they're having this difficulty. So we have issued some waivers on our employment and training side. They've been limited compared to the 4,000 on the feeding side, but the agency's committed to those to make sure that the folks on the ground, when they talk to us about what their need is to serve the customer at their location, that's something, again, that all of us here today are committed to ensuring that we're providing to those individuals, to our partners who are working with those individuals on the ground, to meet them where they are. We're committed to that today. We've been committed to it throughout the pandemic, and as we look forward, we're all committed to continuing to make sure that that happens so that we can serve folks in the way that's best for them.
Thank you.
A hallmark of this administration in the midst of this unprecedented health and economic pandemic has been flexibility. It has been directed for each of our areas of responsibility to look and see how we can be as flexible as possible in meeting the objectives of the program, but meeting the moment. And so we have, in regards in the TANF program, with work being a foundation there, okay, our flexibility has been around allowing states maximum flexibility, understanding that we've had an environment where for a long time we were encouraging folks to stay at home. Then the way that we approached work didn't work in the context of that. So to create the flexibility to allow for that. But as we begin the process of getting back to some semblance of normalcy, we also want to use those flexibilities, but to achieve that work objective. And so all of us have been engaged in how can our programs be as flexible as possible to achieve our objectives, but understand the moment that we find ourselves in.
Thank you for that, Director Carter. Assistant Secretary Pawlish, would you like to add anything to that?
Yeah, absolutely. It's odd to say that one of the positives that's come out of COVID, but one of the things that we've seen come out of COVID is states have been forced to think more creatively. They've been forced to innovate. They've been forced to come to us and ask us for additional flexibilities or additional waivers. And to Clarence's point, if it's legal, ethical, and moral, we're all for waivers. But in many instances, what we found was, and we communicated this to the states, was they didn't need our permission to do the things that they wanted to do. And really just allowing them, freeing them up to take a chance and to think outside of the box. You know, that's what happens when there's a jolt to the system like this. The states were quite understandably overwhelmed, and they had to think differently about how they were going to serve their customers. And they came to us, and when we could, we absolutely gave them the flexibility or the waiver that they needed. But oftentimes we said, well, you don't need a waiver from us. Please, well, we're not the reason. We want to help you do this. So please move forward, be creative, come up with innovative ideas, and we will support you along the way. And that's the key, is making sure states don't feel as though they always have to come to, especially the Department of Labor, every time they want to do something and ask my permission to do it. They have attorneys just like we have attorneys, and we want to work with them so that they understand the law and they understand the regulations, and then they can work within that regulation. Because if we created a scenario where every time they want to turn on their computers, they've got to call DC and ask me if it's okay to turn on their computers, we're not going to get anything done. And that was, again, one of the positives that we saw come out of this, is that states didn't have the opportunity to check with DC every time they wanted to do something. And we want to encourage that, again, within reason, but we want to encourage that type of innovation and creativity and thinking about how we can provide services differently, especially in a time like this.
I want to add to that. I think at the end of the day, when we move to a culture of yes, and we've removed the flexibilities, or we've added flexibilities, at the end of the day, if somebody is working and they're moving themselves out of poverty, and we are getting that outcome of needing less government services, then we have accountability and an outcome. And that is the ultimate goal for each and every state and locality, is that we move people to success and that they are able to stand on their own 2 feet. And so our flexibilities and our assistance should not hamper them. It should help people move to that state. So if we measure outcomes and we measure the success of human beings, then we have accountability. And those flexibilities should not get in the way of that.
And I just want to so amplify that point. Our objective has to be growing the capacity of those we serve to reduce their dependency on these vital supports. We do not see as value added for an individual or a family to have to live a life in the context of our supports. Are these supports vital? Yes, they are. But they ought to be a mile marker in a life's journey, not a destination unto themselves. And so our outcome measures have to be, did we help that individual or family move the needle that reduces their need for these vital supports?
Yeah, and Christy, I've got another hashtag for you. One of the things that I've challenged our folks to think about at Labor is, every decision that we're making, does it do one of 3 things, or hopefully all 3 things? Does it increase opportunities for our customers? Does it enhance accountability for our grantees? Or does it improve outcomes? And to Lynn's point, it is all about outcomes. I've stressed with our folks, please don't tell me how many folks we're serving. Serving isn't the answer that I'm looking for. I'm looking for the job. I'm looking for the degree, the credential, the apprenticeship. I'm looking for the outcome. Telling me that we've served millions and millions of people actually tells me that we're being ineffective, because we're not actually getting millions and millions of outcomes. And that's really what we're after. And we've got to change the way we think about it. It's not merely providing services so I can tick a box and say, yes, I provided John a service, or I provided Clarence a service. It's did I get them the outcome that they needed? And John's outcome is going to be different than Clarence. And what I need is different than what Clarence needs. And we as a workforce system, and we as the partners, have to realize what it is that individual's outcome is, and help them get to that outcome.
Absolutely. And just thinking about the outcomes and thinking about the examples that all 3 of you have provided about states who have had just some confusion about things that they could do or couldn't do, or maybe some misconceptions, misunderstandings. I'm going to go ahead and read a question that came in along those lines and ask each of you if you would like to respond to some of this. Basically, they're asking about, beyond modeling, partnerships and working together and talking together, how does the federal government plan to help the states replicate horizontal work? In their experience, there is a lot of confusion of what's required across different federal programs versus what's flexible versus eligibility referrals, et cetera. And if we all agree that states need support to replicate the horizontal work, how do we plan to enable, fund, and mobilize that support? And I think that, one of the next discussion questions, we were going to move into talking about different funding streams of our different agencies and what they can be used to support. So as a precursor to that, what kinds of thoughts do we have around how are we going to help states move into that think horizontally? And I'll go ahead and, John, I'll go ahead and start with you. Sorry, Assistant Secretary Palish.
Yeah, so that's the key is how do we stop talking about this and make this happen at the state level? And I think one way that we do that is by having conversations like this, by bringing the partners together, by asking the state and local folks to do the same thing, to bring their workforce partners together, to bring SNAP ENT and Voc Rehab and all their other local partners, as well as their nonprofits, the Goodwills, the United Ways, Community Action, whomever their workforce partners are. And I use workforce in the broadest sense of the term. How do we bring those folks together and just start communicating, start sharing information? And I don't think that this is going to be a short-term solution. This is not something we're going to fix in 6 months or a year. But once we start talking, once we start sharing, then we can start moving on to real concrete examples. And Christy will know where I'm going here. But in Kentucky, what we did was we built a single case management system. And again, what that allowed us to do is that allowed us to serve SNAP ENT customers and WIOA customers in the same case management system. So we knew what each other was doing. We knew what services were being provided. We didn't have to ask the individual the same questions multiple different times. We knew what programs they were eligible for and we provided them services. So data sharing, and I understand that that's a deep, dark hole. We could go down and talk about data sharing agreements for the next 3 hours. And I realize how complicated it is. But there are ways to get it done. We did it in Kentucky. There are ways to share data across programs. And once you start sharing that data, now you're sharing the customer, because now that customer is being served by multiple partners, and that's showing up in their case file. So we now know what it is they need, what services they're getting, and ultimately what that outcome is that they're looking for. So there will be a progression in terms of how we make this happen at the state level. But it as hokey as it sounds, it starts with us talking. It starts with us knowing who our partners are. It starts with us leaning on each other and asking each other for your expertise in serving customers better.
John, I really like what you just said, and I think that one of the things the question asked is how do we stop talking and make this happen? I don't think we make this happen. I think we have to let the states know, the locals, whoever it is that's leading the charge on this, that we want collaboration, integration, and generative thinking. And so as we move forward on that, the first rule that I learned the hard way probably was leaving the egos at the door, and then being able to figure out whose rules get us to an outcome. And at the end of the day, I found that each one of our silos rules were different. And so we competed with each other for customers. And then we fought to not have certain customers in certain programs. And so by bringing everyone to the table, getting that turf out of the way, we found that we could be very successful. And so my question is actually back to the states and the locals is, how do you want to do this? And how can we serve you to get it done? Because you know your community and you know your state. And for me to come in as a Fed and say, here's what I think you should do, may not work. At the end of the day, all I'm asking you is less dependency for your customers on government services so that they have the dignity and respect they deserve. How are you going to get there?
And I couldn't agree more. I want to amplify the point. I think that the question, the question, it operates again from that mother may I posture.
Gotcha.
Where it says, okay, Mr. or Ms. Federal Government, will you allow us to? Okay, we believe in this administration to enable states and communities. And so it really needs to be your vision that we then, invoking this culture of yes, help figure out a way to get to. So this idea, when the first thing we do is say, okay, are we allowed to do this? That's the wrong place to begin. The right place to begin is, what is it that we want to do to enhance the well-being of our residents? Okay, put that together and then engage us to help you get to the yes of that.
Clarence, I want to add on that, and I've heard you say this before, and I heard John say it earlier, is it shouldn't be a question of may I do that, but how do we get that done? And that's really where we all are on this, is when the local provider, when the recipient is saying, how do we get there? Don't assume that it's just the federal regulations that's keeping that from happening. A lot of times the state and local partners can do things that they don't know they can do because it's just the way that we've always done it. And I hope that the message that everybody's hearing from us collectively today is, if the way we've always done it is working for the families that we're serving, then that's great. But there are places that it's not working, and we all want to help make that happen. And to the earlier question on regulatory changes, if they're necessary, we'll make them. But the reality is there's often a lot of ways to do these without regulatory changes, even without waivers. And states don't know that. Sometimes our federal staff don't know that. But they're all committed. We're all committed to making that happen. And so we want to be hearing from our states and from their local partners about what it is that the folks, the families we're serving on the ground, what do they need to get to that place that they want to be, and let's figure out how to help them get there. And we meet regularly as a team. We're committed to that. This is not us out saying this sounds wonderful. This is us committing to saying we don't know the path forward for everybody. It's going to look different in every state. It's going to look different in every local jurisdiction, but we're committed to helping get there. Our teams are committed. I believe all of our teams across the board are bought into that, as are our partners. So I think that's what we're excited about, and we're all just working to get to yes, as Clarence says.
Well, I can certainly reflect that it's been exciting to hear all of you talk about your commitment to this, as I've said before. And it sounds like through moving toward one workforce and through this initiative and this partnership that has been struck up and is really working well, it sounds like the approach will be to have states put together a menu, so to speak, of the approaches that they think best fit what they need to do to serve their customers. And that menu may or may not include all three of the programs represented by you three today. It may include other pieces that could need to be pulled in, CMS, for example, or HUD, or other supports that are necessary that may not be part of it. So is the approach that we are hoping for through this to have exactly that, to have what both assistant secretaries and the deputy undersecretary and director reflected, that states bring to you all, here is our idea and here is how we think it can work, but this is what we want to make sure is legal, ethical, and moral before we proceed. Is that the approach that sounds like we can make work? Assistant Secretary Johnson, I'll start with you this time.
I would just say absolutely. You've heard our commitments. You've heard our desires to have a better workforce integration than ever before. I know that with this team, we're going to get there. And so I'll just end on that.
And Christy, if I could, I just want to amplify a point that Assistant Secretary Johnson made a little bit ago. Okay? It is not simply about the programs operating under the same roof. I administered the Department of Economic Security in Arizona, where every public assistance program was under the same roof. But even physically under the same roof, they all operate under their own rules. And so just the fact of that location alignment doesn't align the objectives of the programs. And so this whole initiative is about backing up and thinking about our end goal. We're beginning with the end in mind of getting folks who have been workforce fragile back into the labor force, and then looking across all of our resources and leveraging them to that objective. If you were to add up collectively the assets of the three major programs that these three principals administers, you are talking about multiples of billions of dollars, okay? But we end up chopping them down into much smaller pieces because of our silos, our rules, and our regulations. And so our objective here is not just physical location. It is literally integrating integrating thought, integrating outcomes to achieve a broader objective, to make the whole greater than the sum of its parts.
Absolutely. Thank you, Director Carter and Assistant Secretary. And I'll turn to Assistant Secretary Palish to see if you'd like to add to that. Just states bringing plans to us, to this group.
Absolutely, and I won't commit for either the Department of Agriculture or HHS, but I will commit for the Department of Labor that our regional administrators have heard this speech from me for the last year and a half that I've been in DC. So they are ready to serve, they are ready to facilitate, they are ready to help with those conversations at the state and local level, depending on what the idiosyncrasies of that state may be. And one of the things that we've been trying to do is provide governance training to our state and local workforce boards, so that everybody understands what their roles and responsibilities are, and quite frankly, what the roles and responsibilities of the Department of Labor is. And that helps them understand, okay, this actually falls under my purview, or this falls under the state board's purview, or the governor's purview, or the Department of Labor's purview. So we've tried to educate, we've tried to facilitate those conversations. We've tried to encourage the type of behavior that we want to see. Later this month, we'll be putting out a guidance letter to all the state workforce agencies defining something called priority of service, which has existed in the WIOA law since 2014 and has never been defined by the Department of Labor. Priority of service means you have to serve those that are basic skills deficient, low income, or receiving public assistance. But what does it mean to provide priority of service? Well, for the first time, we, the Department of Labor, are going to put a percentage on that. We're going to say that that's 50.1% of all the customers that you serve have to be from one of those three categories. And in that same guidance letter, we're going to say, and we hope that you aim for 75%. And the states are going to say, oh my gosh, well, where do I find all of these customers who are basic skills deficient or low income or receiving public assistance? And my response is, well, you should talk to your workforce partners. Talk to the Department of Agriculture, who has 40 million people under the SNAP ENT program. Talk to your TANF partners, who have millions of customers that they're serving. So again, we're trying to educate, we're trying to facilitate, and where we can, we're trying to push and steer to say, hey, this is the type of behavior, these are the types of outcomes that we're after.
Thank you. Absolutely. Deputy Undersecretary Lips, do you have anything to add to that as well?
Well,
The
Christy,
state approach.
I think John said it all, but I'll never pass up a chance to reiterate very important things. Priority of service is extremely important. One of the things that we've heard for a long time for those of us, particularly in the nutrition space, is that we have a lot of folks who have additional challenges to overcome, who get into systems where people focus on their inabilities and not their abilities. This is the population that we need to serve. ENT is a program that does that every day. It provides inspirational stories of hope for the individuals we serve all the time. But ENT doesn't need to become the program that serves that population. That's not one workforce. We're moving together to make sure that folks can be served across the spectrum. But I assure you, as John said, if a state workforce agency comes to their state SNAP agency, to USDA, and says, where do we find these folks that you want us to serve? How do we serve them? Our team is ready. Our national office team is ready. Our regional team is ready. Our local partners are ready. And we want to help folks get there. We're committed to the things that Assistant Secretary was just talking about. And we want to make sure that those individuals are served in the way that they need to be served. It's all about a human-centered design of focusing from the perspective of the recipients and the family we're serving, and to ensure that they all receive the services they need. As Assistant Secretary Johnson said earlier, some are in need of skills training. Some of them are in need of basic life skills training. Some of them are in need of child care transportation. We can help with a lot of those things with our ENT funds. And so we're glad to be at the table saying we're all here together to serve our families.
And yes, and Deputy Undersecretary, the SNAP ENT funds are, that's part of what I want to move to next. And so I'll just stay with you for a moment, if that's okay. What I'd like to ask of each of the principals is to talk a little bit about some of the funding streams that are available through each of your programs, and just a little bit about what each of those can be used to provide for our customers, because there are a great deal of ways that these funding streams can complement each other. But that is part of the challenge, is a concern that when you start to use funding streams together, you run the risk of what's called blending funding streams and running amok of federal regulations. So if you would just take a few moments to talk about SNAP E&T funding, the different types, and some opportunities that you all see with moving forward with that.
Sure, and the folks at our SNAP E&T conference are going to learn a lot about that this week. For those of you attending the REX conference, feel free to ask for a login to come view those sessions later, but I'll give you a very high-level overview today. Congress provides for all of the states that run the SNAP program what we call 100% funds for SNAP E&T. So states get a pot of money that we distribute amongst the states for actually developing and operating the core of the SNAP employment and training program, and that's really for the state costs and administering that. Most of the E&T program is run through local partners, and our regional offices are ready and willing. If you know of a local partner who's doing a great job with workforce training, who's meeting individuals where they are, moving them forward and into successful employment metrics, those are the kind of folks we're looking for. And we can help bring them into the state. The funds that they're already expending can count as the state match for what we call our 50-50 funds. And Congress has provided us a unending drawdown on those funds. Obviously, we have to go ask every year for the appropriation, but the statute says that we have a bottomless pot of 50-50 funds. And so whether states are putting that money up or their local partners are, we can match that with our E&T funds. So often what we find, you find like a Goodwill that I was at just last week, who's already doing a wonderful job of meeting families where they are, of assessing their abilities and helping them move forward on a path to success. We can count those dollars for the state expenditures, and we can bring our 50-50 funds in to match that, and allows them to double the amount of folks that they're serving. We see that across the country, and we're committed to replicating that with our states and partners who are doing a wonderful job. But again, we don't want that operating in a silo, so we want to make sure as states are developing their plans that they're talking to their state workforce agency, to their workforce development boards, that we're building plans that help serve those recipients. But we do have what's a relatively new for a lot of states pot of funds, and is growing, that can help states to meet these metrics on ensuring that they're serving particularly some of the populations with more challenges than others.
And you mentioned transportation, childcare, just different things that SNAP E&T funding can be used for. Can you just provide a little bit of a list of what kinds of things could that be used for?
Sure. So we can pay for administrative costs of operating the program, for direct programmatic costs, and certainly for what we refer to as wraparound services. So SNAP E&T can be used for transportation, childcare, those things I mentioned earlier when talking to Lynn, and even for specific vocations, we can pay for things like work boots that are required. So, you know, if you talk about the families we serve on the SNAP program, often they have little or no income, and so it's very difficult for them to acquire the basic necessities to move even sometimes into the workforce that they're being trained for. And SNAP E&T can step up and help with those things. And as states or local partners say, well, I don't know if we can pay for this, I don't know if we can pay for that, that's what our team's dedicated to helping with. And we are here. That's what the whole SNAP E&T conference is about, is helping folks learn about that, but make sure that they know. Again, we're always trying to get to a yes. We want our states and our partners to bring us plans that talk about how they can better serve our families, and we want to help them execute on that.
Well, and having the opportunity to bring a plan to all three of you at once is certainly a great one. I'd like to ask that same question, and thank you, Deputy Undersecretary. Ask that same question to Assistant Secretary Palish, and then we'll go to Director Carter and Assistant Secretary Johnson, just talking about the funding and the opportunities that are involved with funding for WIOA and other parts of your DOL programs.
Yeah, so we unfortunately contribute probably to some of the confusion at the state and local level, because the Department of Labor has both discretionary and formula funds that flow to the states. So the formula funds predominantly flow through a few programs, one being the WIOA program, which is the Workforce Innovation and Opportunity Act, which is the major job training program. It's about $3.3 billion a year that flows down to the states in formula money. And that's predominantly used for job training. There are other supportive services that are available. Brandon mentioned transportation, childcare. There's another formula bucket of money that I referred to earlier, is Wagner-Peiser money. That's predominantly used for reemployment services. So job search assistance, resume writing, interview skills. That's a little over $700 million that flows, again, from the Department of Labor down to the states. And then the third bucket of formula money is trade money. And that is specifically for individuals who lost their job as a result of trade. So something happened in another country that caused their business to shut down or caused their production line to stop, they are eligible for trade benefits, which include not only retraining, but the reemployment skills and what's called trade readjustment assistance, which is a stipend, if you will. So those are the three major workforce formula grants, but then we also have the discretionary grants. So at any given time, the Department of Labor has about 2,400 active grants, about $24 billion floating around out there, and a lot of that is discretionary. And what we've been trying to do in that discretionary grants or in those competitive grants is in what's called the funding opportunity announcements, which is where we announce the availability of the money and invite, you know, whether it's nonprofits or community colleges or trade associations, state workforce systems, whomever, to apply for these funds. What we've started to do is weave in this idea of one workforce and this idea of partnership, and asking them to tell us how they're going to use these funds to further facilitate that collaboration and cooperation across workforce partners at the state and local level. And also, how are they going to sustain after our funding is gone? So there's a lot of money that flows out of the Department of Labor. And again, it can be confusing. And that's why, as I said earlier, we put out those new rules that allow states greater flexibility in terms of staffing those programs. So in essence, when they get their Wagner, Pizer, and their trade and their WIOA formula funds, rather than having to keep them in three separate buckets through staffing, they can put those into one bucket and staff all three programs with one set of individuals. That's the type of flexibility that we want to create, because there are so many of these different programs that are created mostly by Congress, who will give us money and say, you are now running a trade program, or you are now running a Wagner Pizer program. So anything we can do to make it easier for the states to take advantage of those funds and not have to worry about keeping them in discrete boxes and holding them to every single penny to say, you know, you can only use these funds for this. Really trying to encourage them to, again, use that one workforce idea and serve across programs.
Very good. Thank you.
So Christy, if I could, on the TANF front, I want to begin talking a little bit about the economics. So TANF is entering its 24th year, and it is the successor to the Aid to Families with Dependent Children, which was the primary welfare program in the nation. It is annually a $30 billion block grant to states, which is accompanied by a match from states called maintenance of effort. That the two pots aggregate to just about $30 billion annually to serve economically and socially vulnerable families with children. In addition to that $30 billion, there is currently about $4 billion that are residing in states that has been what we call unobligated. And it's essentially monies that over the course of years, states have not expended. And so those are in bank accounts, I would say, searching for a purpose. Okay, but the purposes of TANF are exceptionally broad, and Congress, in its wisdom, really reduced the ability of the federal government to direct what states can do with those dollars. There are purposes that are about having children being able to be cared for in their home, children of economically and socially challenged parents, for children to be cared for in their home. It is also to promote two-parent families and marriage, and also to reduce out-of-wedlock childbirth. And so with that combination of $30 billion, 16 of Fed, about 14 and a half of states, along with the unobligated balance, those are all dollars that can be used for those purposes. And of course, this issue of one workforce falls squarely in the sweet spot of a purpose of TANF.
So follow-up question on that for you, Director Carter and Assistant Secretary Johnson. The unobligated TANF funds, I'm putting my state hat back on again. You know, when we were in state government, that was not necessarily something we knew how to navigate, or what do we have to do to get to it or to expend it, or what are those sorts of hurdles that you have to clear. Would that be the kind of technical assistance that this initiative could help provide?
Well, it could, but again, know that in that regard, that is an issue that begins with every governor and state legislature. And so where those unobligated balances exist, the governors and legislatures know about that, and that's the place to begin that conversation on engaging those dollars.
I think I would add to that, drawing down your TANF funds that are in reserves is not a difficult thing. It is a conversation with the governor's office on how you do that. One of the things I will add that I think the three of us working together is that about 10 to 15% of the efforts made through TANF is on work. The rest is on other stuff. And so when we talk about helping somebody with that dignity and moving to work and to moving out of poverty, we've got to move the TANF efforts to a work model that helps people achieve their goals. And when 10 to 15% of this $30 billion is all that is spent on work, there is a problem with that, because we will never get there if we don't change that model to tip that on its head. So 70% is work directed and the rest wraps around the culture in America. So I think we have to really start talking about that. Well, I did not believe that when I came in. When Clarence laid that down in front of me, it completely changed how I thought about TANF. There are billions of dollars of reserves. We have to start spending those, especially now because of the pandemic, on helping people move to work. And so the issue is not that there's not enough money. The issue is that we're not spending it on the people that need it and letting them be successful so they don't stay in the system.
That's an excellent point. It sounds like a lot of this initiative will be helping states figure out how to find that, how to repurpose, how to use the money that's already in the system and be able to use that for employment and employment support purposes. Thank you very much for that.
And Christy, I'm sorry, again, if I could, this is what it's important to note that this is not an initiative where we are saying we need more money to do this, okay? We need to be more efficient and effective with the dollars that we have appropriated. I need to say again, there's $30 billion every single year for the past 24 years. $30 billion for the objective of supporting economically and socially challenged individuals with families with children. And so it's not about us not having enough money. When you add to that, there's a child care appropriation, there's the WIOA money, there's the SNAP-E&T money. It is not about not having enough. It is about us operating vertically and siloed that doesn't allow us to leverage everything that we have towards our objective. And that is what this collaboration here is trying to achieve today. It's that leverage. Leveraging all of these assets to achieve a shared purpose.
Sorry,
I get a little revved up there, but that's
well, you got so revved up, the camera dropped. So we lost you for a moment there. No, and I think that hearing all four of you and your shared passion for producing outcomes, leveraging the resources that are available to us, looking at the many, many resources that we do already have in these 3 and more programs, makes me think about, and this is the last question that I want to walk through with each of you, and then we'll take some additional questions. But this last question is really on how do we look at the outcomes? How do we currently use research and evaluation and data? What are some current barriers that we have? I know there are barriers to sharing data across programs and across agencies. So think about the data, research and evaluation question, and what is your vision for how can we move that forward to show that we're getting the outcomes and to better serve our customers? Assistant Secretary Johnson, I see you are ready to go with that one.
Thank you. I think we have to really think long and hard on this question. First, we're very fortunate here at ACF. We have the Office of Planning, Research, and Evaluation. They're hosting this conference. They do a lot of research and a lot of evaluation. At the same time, we need to look at what the states have available to them data sharing is overcomeable. That's a word. We can share data. We can work with each other. We can help someone move up and out. But we did a workload study. 70% of my staff's time was on compliance, crossing the T, dotting the I, making sure the paperwork was in on time. 30%, whether it was child welfare, TANF, child support enforcement, my Department of Labor programs, it didn't matter. Head Start, we were spending time on accountability and compliance, and we never moved out of that regulatory stage of the value curve. We never moved to a place where we said, let's measure an outcome. To some people, an outcome was that compliance. Well, we got everything in on time. We have got to move to asking the person we serve, what is success for you? What is opportunity? What is the education and training you need? And then how do you get there? How do you get there? We don't do for people, we do with people. And so how do we move to that so we have an outcome? The outcome definition is what we have to start measuring, not the compliance definition. And that, if we get to outcomes, we don't have people in our system because they're successful with dignity, then we're compliant. And so we need to flip that upside down. And it is something that has happened. You talked about AFDC all the way back. This is not new in government systems around human services. We need a new delivery of human services, and this is the way to go about it.
And if I could add, so in our work in remaking the safety net, one of the things that we have focused on is we have to measure differently. We are very good at measuring outputs. We can tell you how many units of service we've delivered. We can't tell you the capacity of anybody that we've served, how that is built. And so we have been working with our Office of Planning, Research, and Evaluation and another partner to design a set of outcome metrics that are all about proving that our intervention grows capacity to reduce dependency. And so you will see from us in the not too distant future a number of demonstrations that are organized around these new measurements. We will be able to tell that we have grown capacity or increased the functioning of those individuals and families that we serve, and that has resulted in the reduction of their dependency. We need to know how to measure that.
Christy, I want to add one more thing to that, just as an example. We were doing what was a bell curve measurement in my previous job, and we took the 20% that were above 200% of poverty to measure how long they'd been in the system, any system. It could have been food assistance, TANF, Head Start, it didn't matter. How long had they been in? What services did they get? And if they had been in a long, long, long time, why? Because they were already at the 200% level, and most of our programs didn't qualify them for that. So why are they back? We found that we couldn't follow up on that because every time they came back after being gone for a while, they got a new SNAP number. They came back after being gone a while, they got a new TANF number, a new child welfare number. So we couldn't tell how many times over 20 years a person came in, went out, came in, went out. So we couldn't even identify what was happening that caused them to continue to need us after being successful. We have to change that kind of thinking, and we have to come together to say, we need to measure people, not numbers, and learn why they keep coming in and out of our systems. And that would help us move people to success. That's just an example of what we couldn't do it with 200 percenters.
Yep.
Right. But you knew what the outcomes were because they kept coming back in. And so I'll move to Assistant Secretary Palish and Deputy Undersecretary Lips for just talking about data research evaluation. You know, how do we tell what are we going to do to look at those outcomes? How can we approach that? And how do you currently do it that you'd like to shift? Starting with you, Assistant Secretary Palish.
I think one of the important things is, and again, we at the Department of Labor fall victim to this, and I will take my fair share of the blame because the state of Kentucky fell victim to this, is understanding our data inventory, understanding our data governance, understanding exactly what it is we have available, and our ability to report and communicate that to others. One of the challenges that I pose to our folks is in the last WIOA annual report that we sent to the Hill, we're required to report to them annually. There's a measure in there, it's training related employment. So what percentage of employment was related to the training that the individual received? And in last year's annual report, we told the Hill that it was around 25%. So 25% of the people that we trained in WIOA found a job related to that training. Now, shame on the states for putting folks into training that wasn't helping them find a job. Shame on the feds for allowing states to report that to us and for us doing nothing with it. And shame on Congress for getting that annual report with the same data and doing nothing. So part of it is all of us understanding all of the data we have, understanding what that data means, and then actually taking action based upon that data. And that gets to your evaluation point. We need to better understand what in our grant programs is working, what are the levers that we pull that get us the best outcomes, and make sure that going forward, those funding opportunity announcements that I talk about, when we're announcing available funds, making sure that we're requiring those grantees to use those proven levers to get folks back to work. And that's the outcome that we're after, is how do we find employment? How do we make sure that the people that we are providing services to actually end up getting a job? And until we understand that, and until we, at the federal level, at the state level, at the local level, until we really understand our data, until we live with our data and we know its strengths and its weaknesses, and we're able to report out, it's repeatable, it's defensible, it's all those things you hear about data, we're going to continue to struggle with this. And states are going to send us reports that we rubber stamp and send to the Hill, and then the Hill waits around until next year when we send them another report. That's the cycle we have to break, is really understanding what is that data telling us? Are we measuring it right? Are we reporting it right? Because if we're not doing that, then we're all just playing a shell game where it's a wink and a nod, and we're passing the data on, and we're just moving on to the next quarter and doing the same thing.
And people continue to come back into the system, to Assistant Secretary Johnson's point.
Correct.
Thank you very much. Deputy Undersecretary Lips.
Yeah, Christy, thanks for that. And that's a great place for us to pick up. I appreciate that. I think they said this was the 20th annual REX conference and their first virtual. This is our first ENT conference and our first virtual. So we're just starting the count. But it's important to focus on research and evaluation. We do a lot of that at USDA, and there's been a lot of focus on that recently. Even before my arrival, the team had really started to focus on that, because as we start to spend more money on ENT, we have to make sure that those funds are being used to help folks move into a job. And measuring that is often difficult. States are standing up new programs. They have different metrics. Assistant Secretary Johnson talked about SNAP recipients coming on, coming off. We know there's high churn. We don't actually know what that is because we haven't been able to measure that. Some states do. At the federal level, we don't. And we have some new longitudinal database opportunities to start studying that over time to see how our programs are helping folks move forward or not. And certainly as we look at the ENT space, we're doing a lot of research across that front to look at the percentage of folks that are moving into a job, their earnings over time, those important metrics that show us whether we are actually helping folks move to an outcome that matters. And if I may steal a little bit of time, since Clarence started preaching a little bit earlier, I'll get off on my point. The thing, and I told the folks at our conference earlier I was going to talk about this, and so I've been looking for the place to interject it. But as the metrics are so important, and they say to us, they say to our partners, they say to Congress, is the money we're spending helping to bring outcomes? But we have to remember those outcomes really translate into stories. And, I went to one ENT partner, and Keith, who had graduated their program, showed up in a three-piece suit. He graduated their program. He had been homeless on the street, recently divorced, moved across the country. That provider found him on the street, met him where he was, identified his ability, utilized the ENT funds through workforce training to get him into a job. And he was there that day to talk to us about how he's now a dealer of hope. And when you see those local participants, those local families gleaming with joy and hope from what all of our workforce training provides to them, that's really what John and Lynn and Clarence and I are all committed to. The numbers, the data have to back that up, but it's really the people at the end of the day that this administration is committed to moving forward. And we want to make sure that we're all dealers of hope. That's what today is all about, inspiring our partners to come together and do that and to find the data that proves that that's actually what's happening. So I wanted to get my plug in for the human part of the human-centered design and make sure that we're all focused at the end of the day on dealing hope to those we serve.
Thank you
I just want to add now that, Brandon, you have given Clarence something new to preach about, being a dealer of hope. So thank you so much. I really value that.
And I would say that's a third hashtag that has come out of this. And I would tell you that we have actually, building off of what the Deputy Undersecretary just said, we are entering into partnership with a couple of local agencies that are developing what they call a national network of overcomers, people who have overcome some of the darkest circumstances in life, because we believe in the value and dignity of everybody. No one in our society is throwaway, and we believe that with their will and intention and being supported, that anybody can overcome the darkest of circumstances. And so that idea of being a dealer of hope, that is at the core of what we are all about. It is helping those that we serve overcome those social, economic, and developmental challenges so that they can stand on their own and live out their own unique version of the American dream. That's the hope that we deal.
We're with you, Clarence. Christy with us?
Uh-oh.
I think we lost Christy. You may be leading us now, Clarence.
Clarence, you're the new moderator.
Okay. You know what? I don't have the I don't have the interviews, the chat board in front of me to see if we've got any questions from the audience, because I know that we have we've gone through all of the questions that Christy had teed up for us. And so how about if we move into some final thoughts? So if I can begin with Assistant Secretary Johnson, any final thoughts you want to have for our Rex conference participants?
For all the participants that are here, once again, thank you for your time and for your willingness to listen. For the panel and to Clarence, I'm inspired. I feel hope that we can change the delivery of human services because of what each one of you believe. We're all in this together as leaders, and that we have such a respect for the states, the locals, and the customers we serve, that together we're sending this message of a culture of yes, and that we can deliver hope and we can see success for more people than we've ever seen before. So I'm just going to say thank you, and it's been an honor to sit on this panel with all of you.
Deputy Undersecretary Lips, your final thoughts.
Thanks, Clarence. Thank you, Lynn. I just want to, again, thank HHS for letting us jump in on their conference for us to show everybody that we're committed both at the SNAP-E&T National Forum and at the REX Conference to coming together and helping to move families forward. It is about inspiring hope, but it's about also measuring to make sure that we are accomplishing what we set out to do. And it's all important. I greatly appreciate this team, my colleagues who are committed to this. And, you know, the final message that we want to leave to our partners, to our state agencies that are listening today, when you have ideas on how you can better serve our families at the end of the day, we need you to bring those to us. And let's work together to decide if there's federal regulation, federal guidance standing in the way. We're committed to helping you work through that. Or if not, that we can discover that as well and that you can move on. Our teams at the national office, regional offices are committed to helping you better serve our families, and know that we're here. Call on us anytime, and let's work on making that happen.
Thanks so much. Assistant Secretary Palish.
Yeah, just building on that, you know, we've talked a lot about getting to yes. And I think to Brandon's point, force us to say no. Come to us with your ideas. Come to us with a new model. Come to us with a flexibility or a waiver or a different mousetrap, and force us to say, oh, no, you can't do that because of this regulation or because of this law or because of this policy. And then that's going to force us to say, well, can we change that policy? Can we change that rule? Are there things we can do to allow you to get to yes? So it's great. And I really appreciate HHS and Agriculture inviting little old labor here to join in on their conferences. But come to us with answers. Force us to not just talk as we are now, but force us to actually put this to action and say, hey, here's what we need to do in this part of our state or in this state. Here's where we want to go with this. Is that possible? Can you do that? Can you bring the Department of Education along? Can you bring agriculture along and lay it at us? And that's our job, is to help facilitate that. And to Brandon's point, you know, if there are things in the way, then we've got to figure out how to move them out of the way. because that's really what we're after, is really freeing you up to do the work, because we're not the dealers of hope. You're the dealers of hope.
That's
The
exactly
folks
right.
who interact with the customers.
Yes.
It's our job to help you be better dealers of hope and to serve more individuals and to provide greater outcomes. And that's really what we want here is how do we get the outcomes that we're all after, and sharing research and sharing the things that we've learned across programs is going to be hugely helpful to everybody. So just start those communications, start building those relationships, continue building those relationships. And if needed, tap us here in DC and say, hey, we've run into a roadblock in this state or in this area, and we need your help. And again, I'll commit for the Department of Labor that we'll do everything we can to help you get past that hurdle.
I'll add
Absolutely.
on to that.
And
Yes.
folks, if I could say that this is, from my perspective, an unprecedented collaboration. Each of these principals, they have massive portfolios and they are responsible for every element of that portfolio. But they understand the power of their resources and have agreed to lock arms. And if you leave this with no other understanding, it is that we are begging for the same kind of collaboration at the state and local level that we are trying to forge here. We want to, around this issue of one workforce, create a culture of yes. How do we get every American who should be working, how do we get them into a job, a good paying job that allows them to sustain their life, and career pathways that allow them to chart their own freedom and self-sufficiency? So with that, Christy, if we have you. Oh, okay. I think
You
we
have me
lost-
back. Yes, I am back.
Christy,
Yes, and I had no doubt that you all would be able to carry on without me. So that's, it wouldn't be a virtual event without a dropped connection or somebody forgetting to unmute. So I had to contribute. I do want to say that one thing I want to make sure we address, thank you all for those closing remarks, because I think, yes, we're begging for that to happen at the state and local level, and we're celebrating where it's already happening, because I know a number of you have examples of where that's really happening at the state and local level. There were some questions that came in that, because I dropped off, we didn't have a chance to answer. So what I would like to commit to this group is that I will roll up those questions and get them to all of you so that we can put our heads together and put a response out. And I'll work with Gabrielle Newell through OPRE, who's been coordinating this, to make sure that we get those answers back out. And to the people online who asked those questions, I do apologize for the technical glitch that ran us against time. I also want to just say to all of our panelists, a giant thank you. Having had the opportunity to work with and interact with each of you, and with the folks in OPRE and just the different agencies, there is unparalleled commitment that I have heard and seen and witnessed firsthand to accomplish the things that we're talking about. It's walk the walk and not just talk the talk, to Assistant Secretary Johnson's point. So I do want to thank all of you. And I think that, if I could offer one last hashtag, and Clarence knows what I'm going to say when I start talking about this, is we, in our collective programs and silos, again, we've been working better, but we've always done what we've always done, and we always get what we've always got. So I would challenge everybody to be a benevolent disruptor. And what I mean by that is go in with the good intentions of disrupting and making change for the better. Just don't be afraid of disrupting the status quo. And so that is sort of a tagline that I have adopted, is be a benevolent disruptor. And again, I think that everyone in this panel is certainly a benevolent disruptor and willing to empower state and local partners to do the same thing. So with that, Assistant Secretary Johnson, Assistant Secretary Palish, Deputy Undersecretary Lips, and Director Carter, thank you all very much for taking time and for all being here at the same time live to have this very important discussion. And I'm excited to see what comes next and what states challenge us to do.
Thank you so much, Christy.
Thank you.
Thank you.